wanted to know if the bill will actually have the ability then, when we're in the thick of it, to prevent funerals from taking place, gatherings of people, or limit a funeral to maybe, you know, nearest and dearest, or whatever, or indeed to, because it says here the state, I think it said, if I read it rightly, the state can take control of any, can direct local authorities to take control, to have the ability to take control of a component or components of the death management process in their area. Are we likely to see a curb on numbers of people, on numbers of funerals, and on, you know, a push towards cremation with, I don't know, memorial services in the months to come?
All those things are possible.
Right.
Okay.
Thank you.
Lynn?
Yeah, I've had a query of constituents around funeral poverty, really, and what the implications will be if someone is struggling to pay for a funeral, and obviously the normal processes don't apply. There's not the time factor. I was just wondering if there was likely to be any help for people in that situation, really.
Yeah, it's part of the consideration, because we're thinking about the challenge we think we might face and the overall objectives and what we're trying to do. So if we really are seeing a level of mortality that means that the normal process can't cope, then we'd have to make changes. And the initial part could be about increasing storage of the deceased and powers for local authorities to require places to store bodies. And then we have to consider what that means in terms of whether it's burial or disposal, and whether it's possible that single disposal may not be possible at the top end of the reasonable worst case scenario. And if that's the requirement because of the public health crisis that we'd be facing at that point, then of course we need other direct parts of the system and the finance for that, so that you don't end up having an inability to deal with the practical challenge of large numbers of excess deaths because of the financial means of some of those people. So I take seriously the point you're making, and it's one of the most difficult things that we may face if coronavirus does get towards the top end of the reasonable worst case scenario.